Good morning, everyone. Can you hear me? We're good? Good morning,
Yep.
Paula.
Hello.
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 All righty, let's go ahead and get this webinar started. My name is Mirza Romo, and I will be your moderator for today's event. Really happy to be here. Before we begin, I want to make sure everyone knows how to utilize Zoom. If you have any questions during the webinar, please use the chat tab located on your screen. And also don't forget to type in your questions. Okay, perfect. All righty. So just a very brief instruction here. Make sure your mic and your camera are off so we can clearly listen to Dr. Sandy and to our presentators. And also don't forget to write your questions in the live chat, okay? Perfect. All righty. So let's go ahead and get started. Throughout the webinar, we will be reminding you of a few things. We will be raffling a TreVita goodie bag, so please stay tuned. Only for the members that are here with our on our webinar live, okay? So make sure to stay until the very end. Now, if you haven't already done so, please make sure to fill your health questionnaire form. It is located in our group chat currently on our Zoom. So go ahead and click there. It's going to be very easy to access. And at the very end, if you have any questions, feel free to type those out, okay? Now, without further ado, I would like to say hello and welcome to everyone to the TreVita Bariatric Surgery webinar. For the ones that are just joining right now, this event, my name is Mirza Romo, and I will be hosting and moderating the event today, okay? I want to go ahead and welcome also Paola, who's our operation manager. She will be joining us as well. And here it is, Dr. Sandy Martinez. I would like to introduce you to our doctor keynote speaker for the day. Dr. Martinez is an American board certified surgeon, highly experienced bariatric surgeon, and a valued team member of the TreVita team. If you have any questions, we're going to have a Q&A section at the very end. For now, she will be sharing her expertise, insights with us today, and also answering any questions you might have. Okay, so Dr. Martinez, thank you so much for being here with us today.
Hello, good morning. Thank you for having me. And I want to congratulate everybody that is connected to the webinar, because this is a very big step, a very important big step to look into bariatric surgery and to put our health in primary before everything, okay? So let's get started with some information that we have for you. First of all, obesity is a medical condition where we have excess of body fat, and this excess of body fat can lead us to negative health outcomes. So there is a lot of causes of obesity. There's not just one cause, we have multiple causes. Sometimes it's our eating habits, that we have bad eating habits, and this can lead us to start gaining body fat. There can be some specific event that can trigger obesity, like pregnancy, or some emotional or physiological factors, psychological factors, as well our environment. Sometimes the people that are around us can lead us as well to bad eating habits, to bad habits in general, or lack of exercise, some medical conditions. A lot of things can lead us to start gaining excess of body fat. And while we have a way of calculating in what grade we are of obesity, and this can help us lead us to what treatment is better for us. So depending if we are overweight, if we are obese, or we have an extreme obesity, super obesity, this will help us know what treatment is better for us. So depending on the grade of our obesity, there can be a change in our lifestyle, in our eating habits, in our level of activity that it's enough to lose the weight, or we have to start medical management, or we have to look into bariatric surgery. So it's very important to classify what type of obesity we have and then look for the best treatment for us. So there are a lot of medical conditions that are linked to obesity that are secondary to this excess of body fat. We can have sleep apnea, we can have heart disease, diabetes, hypertension, kidney disease, fatty liver, or there can be reproductive issues secondary to obesity. So there are a lot of things that are related to this condition and helping us lose weight, helping us eliminate that excess of body fat will improve all these medical conditions that are secondary to obesity. So regarding why we are here in our webinar, well, this is mainly because we are looking now into bariatric surgery, and we can offer a lot of procedures that can help us depending on what we need. So we have restricted procedures. The most popular procedure right now worldwide is the gastric sleeve. This is mainly a restricted procedure. And then we have malabsorptive procedures where we combine a small stomach with malabsorption. We will talk more into it. That is the gastric bypass, the mini gastric bypass. That is just some differences from the gastric bypass. We have the duodenal switch. That is practically a combination of the gastric sleeve with the gastric bypass. And we can offer as well revision surgery in cases that we already have a primary procedure and we have to lose more weight, or we will talk about it right now. So the first procedure that we are going to talk about is the gastric sleeve. Here, the main part of the procedure, as I told you, is a restricted procedure where we have a smaller stomach. As well, we have the metabolic component because the part of the stomach that we eliminate is where we can produce a hormone that is called ghrelin. This hormone gives us hunger and gives us preferences for certain foods. That's why as well we can say that it's a metabolic component. And when we eliminate this part of the stomach, that is the part that you can see on the right of the image, we will immediately eliminate the hormone ghrelin. So we will have no hunger from the day after surgery. And we can see like magic as well that we change certain preferences for food. The day after surgery, maybe you like normally apple juice, and then we give you apple juice at the hospital and you say, this tastes disgusting, this tastes very different. And this is because we are eliminating the hormone ghrelin. So here we will remove from 70 to 80% of the stomach. A lot of patients ask me, what exact part of the stomach are you eliminating? We cannot know because every stomach is very different. We have very round stomachs. We have thin stomachs that are very long. So we have a lot of shapes of stomach. What we do know is what we leave inside your cavity, because we calibrate with a boogie. We put a boogie inside your stomach. We do the staple lines around this boogie so we know what is remaining. And this will be a very thin tube with high pressure inside it. So when the food or the liquids in the initial part enter the stomach, we can feel tight, we can feel restriction, we feel that it takes time to pass through. And this is what will give us a very fast and effective weight loss. So here we can achieve from 60 to 70% of weight loss of all the excessive weight that we have. Of course, if we work hard, that's what we want to do. If we work hard with the procedure, we can achieve better results. This is the percentage of weight loss that we can have because of the procedure. But we don't want to leave everything to the procedure. We want to work with it and achieve better results. So another procedure that we have is the gastric bypass. We have two types of gastric bypass. First, we will talk about the Roux-en-Y and then the mini gastric bypass. So here, what we are going to do is create a very small stomach. This is called a pouch. So you can see in the upper part how we are creating a very small stomach. And after that, we are going to skip a part of the intestine. And that part that we are skipping will not absorb because it will not have contact with the food. A very common question is what happens to the other part of the stomach? What happens to the other part of the intestine? Are you going to take it out of the cavity? Is it going to stay there? But if it stays there, is this dangerous? There is, we will disconnect this part. So there is no problem that it stays in the cavity because it's disconnected from the upper part, but in the ender part where the Y is, we will connect it again. So everything continues like before. We have acid in our stomach, then we have the bile in the primary part of the bowel. All this will continue its normal course, and then it will connect again when you can see that we form a Y. And there, it's where it will have contact with the food. All the acid of the stomach, the bile, everything will have contact again with the food. And in that part is where we will continue to absorb what we are eating. So here, we will achieve, just because of the procedure, 70 to 80% of weight loss. This is a more effective procedure. This is the gold standard in bariatric surgery for weight loss and metabolic surgery. And here we are combining a small stomach that is restrictive and the malabsorption part where we absorb less of everything that we are eating. It's important that we know that in this procedure, we have to be taking supplements for life because we are absorbing less. We are absorbing less of what we want to absorb less, like fatty food, like carbohydrates, but as well, we will be absorbing less of nutrients, minerals, vitamins, and we have to be supplementing for life. The good part of this is that right now we have bariatric grade supplements that we can find through Amazon, through the internet, and we can take just one dose a day. It's very comfortable. And with all the benefits that we will have from the surgery, it's just one small thing that we have to be supplementing ourselves, and it shouldn't be any problem. Another type of bypass that we have is the mini gastric bypass. Here, the only difference with the previous procedure is that we are creating only one anastomosis. Instead of creating the Y in the ender part, we just do one connection. And here, the most common mistake of people is thinking that the name mini means that we will lose less weight than in the other procedure. It's exactly the same results, exactly the same procedure. The only thing that we are doing is creating just one anastomosis instead of two. In what cases I would recommend this procedure? Not for patients that want to lose less weight, because we are telling that that is not the difference, and not in patients that have a BMI below 50, because here we would opt to do this two anastomosis, because if you see in this image, the bile in certain way can have contact with the pouch, and it's better if we do another anastomosis so it never has contact with the pouch. So for better results long-term, regarding the bile not touching the pouch or not having reflux with bile, I would recommend having two anastomosis, the standard bypass. And this bypass we would leave in extreme cases where we have high BMIs and we have to shorten the time of the surgery, or it's a very complex cavity and we need to make things smoother. So in these cases, we do perform just one anastomosis to have better results And in the future, if we have any problems, we can convert it to a standard bypass. And the other procedure that we can offer, and this is important to know that not many surgeons can offer this type of procedures because there is a very specific training to be able to complete this procedure, is a duodenal switch. Here, what we are going to do is to have a gastric sleeve, and after that, in the first part of the duodenum, that is the first part of the small bowel, we are going to add there a bypass. So here, why is it more effective than the gastric bypass, or why is it better? What is the difference? Well, we are conserving the pylorus of the stomach. So this is very important. So the food, the liquids, everything stay more time inside our stomach, our very thin stomach. Remember that we are creating a sleeve, so we are having restriction. And it's important to know that if we have a pylorus, everything stays there more time. And this gives us restriction compared to the gastric bypass, where we are creating something, we are creating an anastomosis, and food can pass more quickly into the bowel. So here we have the pylorus, it controls, it's a sphincter, we can control how much time the food remains in the sleeve. And after that, because we have this sphincter, we can connect the intestine in a more ender part, so we can have more malabsorption. This is important when we have a very high BMI, when we have a BMI above 50 and we have to lose more weight, or when we have a young patient, 20, 25, 30, 40 years old, that we have a long life ahead of us, and that we know that we have a long time to maintain the results of the weight loss, of controlling the chronic diseases, diabetes, hypertension, when we have a lot of life ahead of us, and we know that in certain point we can start regaining the weight. So this is a procedure where we have had the better results long term. This is the most important part. Long term, this is the best procedure that there is. So as well, having the pylorus, many of you probably have heard about the dumping syndrome. This is more common in the gastric bypass because of this anastomosis that I'm telling you that we are creating, where the food passes through quickly into the bowel, and sometimes this can cause a certain discomfort. And in the duodenal switch, because we are conserving this pylorus that controls how the food leaves the stomach, then we can see less risk of dumping syndrome, or it controls quickly more than in a gastric bypass. So if you are looking to this webinar and you have a BMI above 50, or you are a young patient below 45, 40, this is an excellent procedure for you. And as well, we have revision surgery. There are a lot of causes of revision surgery. We can have complications from a primary procedure, or complaints. The most common complaint after bariatric surgery is acid reflux, and we will talk about this just ahead. This is the most common complaint. So if you have acid reflux, and probably there's some patients that don't even want to lose more weight, it's just the acid reflux that is killing them, then we can offer you as well a revision surgery to close this space in the upper part to avoid acid reflux, or to add more weight loss if you need so. There is as well revision surgery because of the weight regain after surgery. This is very important to know that bariatric surgery is not magic. We have to work a lot with this procedure. This is the best worldwide treatment for obesity, but as well as in everything, we have to work. And we can have as well insufficient weight loss. Maybe we didn't choose the correct procedure in the first place. Maybe we had a lot of weight to lose and we went for the gastric sleeve, where we have research for lower BMIs, and maybe we have to lose more weight. We haven't regained, but we have to lose more weight, and we can convert to another procedure. So depending on the primary procedure that we have, if we have a lap band, We can offer gastric sleeve, mini gastric bypass, and depending on the procedure that we have, we can offer a second procedure depending on this. And well, it's important as well to know in revision surgery, we have a higher risk of complications. Why? Because we are doing staple lines above staple lines that already exist. This gives us higher risk, of course, of leaks because there are doing staple lines above staple lines. And as well, we have scarred tissue. We have a tissue that is already damaged, manipulated before. It's not a virgin tissue in the perfect conditions to do a bariatric surgery. So it's important just to know that we have higher risk of complications. Some of the pros and the cons of bariatric surgery. Well, as I told you, this is the most effective treatment that there is for obesity. There's no better out there, and where we have the best results, and we will have weight loss, yes, in all the patients. This is a minimal invasive surgery. All the surgery is performed through laparoscopic approach. This means that we have very, very small incisions, less than a centimeter, and through those incisions, we introduce the instruments to be able to perform the surgery. So this is a recovery that is very fast with minimal pain in our abdominal wall. A lot of patients that have already have open surgeries for different types of surgeries or for bariatric surgery, and then they come and have a laparoscopic approach, they see the big difference on the healing process and the recovery. The achievement of weight loss goals, as I tell you, we will have weight loss in all the procedures that we can offer you. And we reduce the risk in case that you don't have any chronic diseases. And we can resolve chronic diseases related to obesity, diabetes, hypertension, sleep apnea. We can see a big improvement from day one after surgery. And with time, most of our patients can stop using medication, can stop using insulin, diabetes, hypertension medication. Everything starts to resolve with the weight loss. The cons that we can have, well, the most common complication immediately or during surgery is bleeding. Here, it's something that we can control, and we can control during surgery, or in case if we present it after surgery as well. We always leave a drain in all our patients, no matter how the procedure went. If it was very, very clean procedure, we always leave a drain that will tell us if there is bleeding inside the cavity. In case that there is bleeding, depending on the amount, we can control it without surgery, or in extreme cases where we have a lot of bleeding, we have to go back to the OR and control it. This is the most common complication, but as well, it can be resolved very easily. We have infections that can go in the most common in the sites where we did the incisions, and this will depend as well on how much fatty tissue we have below our skin. So if we have the more fatty tissue that we have, the more chances of infection in this part, because remember, we are opening and we are manipulating the abdominal wall. We can have blood clots that can form because of this time that we are in bed without moving. That's why the first recommendation after surgery is, as soon as you feel awake, start walking. This will prevent these complications. We can have clots that form in our legs and go to other parts of our body, like our brain, our lungs, our heart. But as I'm telling you, the first recommendation is start walking. And as well, we give in most of our patients blood thinners that will help us prevent this complication. We can have leaks. This is the most feared complication, or what we can hear more in the internet and in every part. And it's not that common. It's just that all the cases of leaks will go out there and put their reviews in the internet and start talking about it. But it's not that common of a complication, but it's important that we know that it can happen. And this will be more common in revision surgeries where we have a tissue that is already damaged. We can have the acid reflux. That is the most common complaint. Why can we have acid reflux? Because we have a round stomach right now, And what we are doing is liberating the stomach and creating a small sleeve, in this case, a tube, or we are creating a pouch that as well is very thin. So now we have a loose stomach and a very thin stomach. So this would be more probable that can be slipping up and down into our hiatus and causing us acid reflux. That's why it's very important that our surgeon takes the time to take a look at the upper part. And if we see that the space in the upper part is wide open, that we have the risk of having acid reflux after surgery, or if you already tell your surgeon, I have acid reflux, then take care of it in the primary procedure, close that space, and make us have a better quality of life long term. And as well, the psychological impact, where a lot of patients are not prepared for the post-op, and they can be the first days a little bit sad, sentimental. Why did I do this? Did I make the correct decision? And we can be struggling the first weeks as well. Remember, a lot of us rely on what we eat, and we make ourselves happy with what we are eating. So this change, this dramatic change, sometimes can impact us psychologically. But the good part is that as soon as we start seeing the results, as soon as we start seeing the weight loss, this all changes. And I can assure you 100% of the patients after a month, 2 months, 3 months are very, very happy that they took this decision, that they started their weight loss journey, and that they are improving generally their life with their chronic diseases, with the excessive body fat, with everything. And as I told you, the importance of the hiatal hernia, that this is what will cause us the acid reflux. As you can see in the image, the first one is how normally we should have our anatomy. We have our diaphragm that separates our thorax from our abdomen, and this muscle has a space where only our esophagus should pass through. So it should pass through the hiatus, and then we should have 3 to 4 centimeters of esophagus inside our abdomen. If we do not have this portion, it slips in the upper part, that space is wide open, and this leaves everything that comes in to come out as well. Liquids, food, everything. So everything is going up and down all the time. And then add to this that we are creating a thin tube, a stomach that is very, very thin, a sleeve or a pouch, then this will get worse after surgery. So it's very, very important that your surgeon takes care of this from the beginning, closing the space, making it very tight, and we don't experience acid reflux. And well, for a lot of you, it's very, very important to know in how much time will I recover? How much time do I have to take out of work? Everything. So it's very different in each patient. Some patients recover from day one. They want to go to the gym. They want to go back to work. They are ready. And there are some patients that go slower. They feel tired, without energy. They are struggling a little bit more with the symptoms. Every patient is completely different. Not because you hear something in the internet, it means that you will have the same journey. Everybody is different. So that's why I always tell patients, take 2 weeks off. Tell in your job that you have to take 2 weeks off. Assure that you have the help that you need for 2 weeks. And in 2 weeks, you will see that you will feel completely ready to get back to your normal activities, to get back to work. And it always depends on what we do in our work. If we have to lift things heavy, if we are sitting in it all the time, it depends on our activity. And that's why it's better to take 2 weeks off. There are patients that can go back very early to work, and there are patients that take the 2 weeks off and then they feel ready. So it all depends on how everything goes. But the top time that patients have to take off of work is 2 weeks.
All right. Thank you so much, Dr. Sandy. That was super helpful for everyone to know and to get to know a little bit more about each individual procedure. Because like you said, everything is 100% personalized based on the client's need. And everyone, we're all different. We're going to need different things. So it's very important that we understand that our services are 100% personalized for each individual. Perfect. So I'm going to go ahead and move forward with the presentation. Just in case you're hopping into our webinar, my name is Mirza Romo, and I'm going to go ahead and walk you through the process of booking your surgery. We have a very, very easy process. We try to make it as seamlessly as possible, super simple. Three-step process would be for you to contact us. Go ahead and contact us. We're going to leave all the information a little bit later in the webinar, but you already have our phone number. You already have our text message. You can text us. You can find us on Facebook as well, and all of the social platforms. We really want to get to know you. Our client consultants are going to address every single one of your questions. We even have client consultants that have gone through the weight loss journey. They have previously gone through the procedures, so they're going to walk you through every step of the way. Second step would be for you to submit your health questionnaire and your financing application as well. Very easy. It takes less than 10 minutes to submit it. The health questionnaire will be reviewed by the doctor. And then we will go ahead and walk you through the next step, which would be securing your surgery date. Once you are fully approved for the surgery, once you know the price, once you know the doctor's notes, if she has any recommendation, the pre-op diet, how many weeks you're going to have to go through the pre-op diet, that it's also going to be provided by your coordinator, then we can go ahead and book you. You're going to have all of the information. It's going to be very clear, very, very, very easy. We're going to go ahead and look for availability in the doctor's agenda, and you can book your surgery with just $500 deposit. That will be pretty much it. Okay, just to book. When it comes to payment options, I do get very often a lot of questions if they need to bring cash, they're worried about that. That's not the case. When it comes to payment options, you can do your payment with a credit card, with Zelle, wire transfers, and ACH. Is very easy and safe for everyone just to go ahead and do one of these transactions as well. And financing options, very important for everyone to know. We have an exclusive relationship with Sundance Medical Financing. They have a really good approval rate. They're trying to help us to approve as many clients as possible when it comes to financing. We know sometimes finances can be an issue and can get in the way of getting us to the next step and providing this healthier journey for you. So they do provide very affordable, low fixed rates and no fees at all. You can apply anywhere from $2,000 up to $12,000. They do offer you 2-year and 3-year terms to pay it all in full. Very easy to apply. Like I said, it only takes probably 3 to 5 minutes to apply. Great news. Great news. For those who are a little bit concerned about credit, right? Sometimes I do get a lot of clients telling me, like, my credit is not the best. I'm not going to get approved. Don't you worry. A cosigner is accepted. So in case your credit is not the best, don't you worry. If you have a family member, a friend that might be able to help you out with that, believe me, they're going to look into it and try their best to get you approved. So don't you worry about that. Just go ahead and ask a cosigner to go ahead and cosign for you, and you'll be good to go. Don't worry about that. No prepayment penalties. Like I said, even if you choose a 3-year term and you choose to pay the loan back in full a little bit earlier, there's no prepayment penalties. You don't have to worry about that either. And Paola, you are next. You're going to tell us a little bit more about the whole operation and about the client consultants and how they're able to walk our clients every step of the way and greet them, meet them, and all of those good things.
Yes, thank you so much, Mirza. Hello, everyone. I'm so happy to have you here. My name is Paola Frisbee, and with my team of coordinators, we make your experience just amazing. Okay, so let me show you how. So with TreVita, we have a 5 days experience, and we're going to go over each day so you know what to expect every single day with us. We're going to send you an itinerary beforehand, and your coordinator is going to help you to review each day in a video call 7 days prior surgery. So let's go with the first day. You need to arrive to San Diego International Airport. And then our driver will pick you up. We're going to send beforehand who's going to be your driver, a badge, a picture, a name, and a phone number so you guys have in communication. Don't worry if your flight got a delay. We have that covered because we track your flight, so you don't need to be worried about anything. Once you get to the San Diego airport, our driver is going to pick you up and cross the border. It's very fast. It's about 25 minutes from San Diego to Tijuana, and then your coordinator is going to be waiting for you at the hotel. We work with really, really nice hotels. I'm going to show you later. It's a 5-star hotel, very, very luxurious. You're going to love it. So this first day basically is for you to relax. We're going to help you check in, guide you to your room, and you're going to relax for your big day next day. The next day is your day of surgery. We're going to perform lab work for you, an EKG, to make sure everything is fine before your surgery, and then you're going to proceed with your procedure, okay? You are going to have also a coordinator in the medical facility helping you with any questions you need, helping you with the check-in at the medical facility, helping your companion if you're coming with one, and everything. After that, the next day is just for you to recover at the medical facility. You're going to be monitored 24/7 by nurses, doctors, and the medical team. We encourage you to walk, as the doctor mentioned, and you're going to feel a little bit of discomfort, but basically you're going to be walking around the medical facility. Everything is gonna be great. You're going to spend 2 nights there, and then the next day is going to be your discharge day. After 2 nights and making sure everything is perfect, you're ready to go back to the hotel to rest for 1 more night. In the hotel, you're going to have your concierge again, helping you with every single detail. And then you're going to rest for your next day coming back to the USA. Same, our driver will pick you up from the hotel, cross you to San Diego Airport, and that will be your whole experience in Tijuana. But your support with TreVita doesn't end right there. We continue with you for 12 months. We're going to review that later. So what is included in our packages? First, as I said, it's not just the surgery. We're going to be with you for 12 months with medical follow-ups, nutritional follow-ups, TreVita care team follow-ups. We're going to be with you monitoring your progress, helping you with any roadblock you can have in the process. So we're going to be your hand-to-hand with you working on this. So you're going to have a dedicated case coordinator. This person is going to help you with all the planning for your trip. It's going to help you with all the medical coordination before your surgery and after. We also offer a medical pass. Every time we bring a client back to the USA, we use a special line. It's called a medical line. So you are not going to wait hours online. It's going to be very fast and it's going to be very exclusive. So you will not miss your flight. Okay, so also our package includes 2 nights at the hospital, as I mentioned, monitored by the medical team 24/7, 2 nights in a luxurious 5-star hotel, all the pre-op labs, EKG, doctor's evaluation. You're going to have a consultation with your surgeon prior surgery so you can ask all the questions you need before your procedure. It's going to be a private room. This is very important because some other companies put you in a room. You have to share with people that you don't know. And for this important experience, you need your privacy. You need to be with your loved ones. So we offer a private room for you. All the surgical materials are covered, hospital fees, the post-op nutritional care is covered, and also we're going to talk later about our app. We have a TreVita app that we will give you 12 months of subscription for free, and I'm going to show you how this is going to be a really good tool to help you in your progress. So let me show you the hotels that we work with. One is the Quartz Hotel on the left. It's a 5-star hotel. It is very, very beautiful. Our client loved the experience at Quartz. We include in the check-in process a wristband that allows you to have your bariatric meals for free, unlimited. So that's, you don't have to worry about bringing food, liquids, everything is covered with us. And also we work with Hotel Lucerna, which is also a 5-star hotel, very, very nice in Tijuana, Mexico. So let's talk about post-surgery care. As I mentioned before, after the surgery, you are not going to be alone. We're going to be together for 12 months. And basically, after 7 days after your surgery, you're going to have your medical consultation with your surgeon just to make sure everything is going fine, your progress, everything is as expected. Then a month after that, you're going to have a nutritional consultation. In that specific moment, you're going to transition from puree to a soft solid stage. So you probably have a lot of questions, and this call is very, very helpful. So you're going to be able to ask everything you need to your nutritionist. So that's very important. And then we're going to follow up at 3, 6, and 12 months after surgery. In some point, we're going to ask for lab work just to make sure there is no deficiencies, everything is going great. We're going to monitor you. You are achieving the protein goals every day, the liquids goals, and we're going to be your cheerleaders in this process. So we're going to be with you 12 months. Also, we have available for you a 24/7 Facebook Messenger for any kind of questions. We have a team of coordinators all the time reading and responding you anytime. So you are not going to be alone. Finally, as I mentioned before, we the day of that you arrive to the hotel, we're going to give you a goodie bag. That goodie bag includes a Bluetooth scale. This Bluetooth scale syncs with our TreVita app, and we're going to give you a special code to be our client 12 months for free. So this tool basically helps you to track your progress. It takes measurements of your muscle mass, water levels, BMI, and you're going to have a visual tool to show you how you are progressing in your weight loss journey. This is very, very helpful. Our clients love this. So this is going to be for free.
TreVita treat me very well. I'm impressed.
They're the best down here, hands down.
Like, I feel like I'm more energetic. I'm definitely sleeping a lot better.
I guess you could say I have a lot more energy.
I'm moving around a lot more than I was. I got a new puppy and I chase her around quite a bit.
It was a great experience. It was very well managed.
That's been the best thing I've ever done. TreVita, been taking care of me.
As you can see, we only have 5-star reviews in Google. So I invite you to check those, review every story, every testimonial there. We work really hard to make your experience above and beyond. We are very passionate about your well-being and we truly care. So I invite you to read our reviews and take this step to work with us.
Thank you so much for that, Paola. Thank you so much. Now, I'm going to go ahead and invite Maribel to hop on our webinar and Q&As. And I know you have a little surprise for us, right?
Yes, Mirza, thank you so much. Hi, everyone. My name is Maribel, and I will be helping our amazing moderators today with the Q&As. I just see that I got so many great questions that we will be answering in just a few minutes. But first, let's go to the goodie bag raffle. And for that, we have a question. So everybody right now, go to the chat box in your screen. You're gonna find in the center the chat box and go and answer the next question. So the question for today, in order to get the goodie bag, is what is the first step to book a surgery with us? So the first person that answered is gonna be the winner. Let's see. Oh my God, Laura McRae says, call TreVita. Yes, Laura, we will contact you at the end of the webinar, so stay tuned. And thank you so much. Congratulations. Oh my God, everybody is answering. Thank you, guys. You were paying attention today. That's exactly what you need to do. Just call TreVita and we take care of the rest.
Okay, so let's go ahead with questions. I know you guys have been typing your questions already on the chat, and Maribel have some of them. So we can start right now. In the meantime, keep typing your questions. We're gonna go over each one. So Maribel, let's start.
Yes, okay. The first question is for Dr. Martinez. Hi, Dr. Martinez. The first question is, when does the drain come out after surgery?
Okay, a very common question. We will take the drain out the morning after surgery. Okay, so the day after, as soon as we see that 24 hours, we have not had any bleeding, that's the most common reasons that we leave the drain for. As soon as we see that everything's fine, we can take the drain out. It's important that you know there's a lot of types of drains. The type that we use is a very flexible tube that when we take it out, you do not have absolutely nothing of pain. You do not feel anything. So you won't even notice when we are taking it out. We will tell you as well, of course, but you won't even notice. You don't have any pain. That's why most people ask, will I feel pain? No, nothing. You won't feel anything.
Okay, second question goes again for Dr. Martinez. This is a very specific question. So this participant is asking, can you do a sleeve with mesh in the stomach from a hernia, plus I have a hernia right side of the stomach?
Okay, so we can look inside your case in a specific. What we can tell right now is a mesh creates a lot of scar tissue. So what we can expect of this procedure is that we will have scar tissue, but we can always have a video call to talk more about it. But yes, we can perform a surgery when you already have a mesh or a hernia.
Perfect. Thank you, Dr. Martinez. Let's go with Mirza. Hey, Mirza, this is a question for you. How do I apply for financing?
Great question. So the financing application is both on our website. You can actually find it there as well. Also, once you submit your health questionnaire, you're going to have access. Once you finalize the health questionnaire part, you're going to see a blue button that's going to give you access to the financing application. So it's super easy.
Thank you, Mirza. This is for Paola. Paola, do we have follow-up care of if there is complications?
Yes, so we are going to keep in touch. As I said before, 7 days after surgery, your surgeon is going to speak with you. It's going to ask all the relevant questions to make sure everything is going as planned. Then after that, we're going to have another video call 1 month after surgery, 3, 6, and 12 months. So in the meantime, if you have any kind of emergency question, we have 24/7 Facebook Messenger, so we're gonna able to help you right away. We can provide all your file, your reports, so you're gonna be taken care of for 12 months.
Thank you, Paola. Next question is for Paola too. It says, how many days is the trip to Tijuana?
Great question. It's 5 days. We expect you arrive the day prior surgery to San Diego Airport. And then you're going to spend 1 night at the hotel, the following 2 nights at the medical facility. Then we want to make sure you have an extra night to rest in Tijuana. And then finally, in the 5th day, you're going to go back to the USA. So it's a 5-day trip.
Perfect, thank you. This is a question for Dr. Martinez. It says, I have CIDP and take meds for it. Can I still have the surgery?
CIDP, let me look into it.
Okay, while Dr. Martinez look for that question, another question for Paola. It says, this person is asking, it will be someone there to help me?
Yes. I will say 50% of our clients, they come with a companion because it's for free. TreVita does not charge any extra for a companion. But the other 50%, they come alone, but they don't feel alone, never. Why? Because we have In every check-in, a TreVita coordinator helping with everything. We have a check-in at the hotel, we have the check-in at the medical facility, another check-in when you come back to the hotel for the last night of rest. So you're gonna be with a coordinator every single time. They're gonna be following up to you 24/7 while you are in Tijuana, making sure you are having a good night of rest, making sure you have all your driver information. So don't worry about it. You can read our reviews and you can see a lot of people coming alone. They definitely don't feel alone. They feel that we are with them all the time. So don't worry about it.
Thank you, Paola. Going back to Dr. Martinez. Okay, I'm gonna repeat the question. It says, I have CIDP and take meds for it. Can I still have the surgery?
Yes, we can perform surgery. It's better if you send us a list of all the medications that you are taking to see if we have to stop certain medications for the surgery. And if we have to stop the medications, you can ask your primary physician if this is okay. So it's important just that we review all the medications and that we see that you are in conditions, of course, to go into surgery.
Thank you, Dr. Martinez. I have another question for you. This participant is asking, can you do the surgery with fibromyalgia?
Yes, as well, we can perform surgery.
Perfect. Another question for Dr. Martinez. Is it still safe to have children after having the gastric bypass or duodenal switch?
This is a very common question as well. Yes, it is safe, and we have to just take care of our supplementation. So there's a supplementation just because we have this procedure, and then there is a higher requirement because we are looking into pregnancy or we are pregnant. So we have to do it in combination, have the correct supplementation, and it will be safe.
Thank you, Dr. Martinez. A question for Mirza. Mirza is, okay, can I bring a companion? And is the transportation private or in a group?
Oh, no. Definitely can bring a companion at no additional cost. The transportation is private. You're not going to be sharing your transportation with anyone else, just with your companion if you wish to bring someone like a family member or a friend. So you definitely can do that.
Thank you. Sorry, kids. Okay, the next question is for Dr. Martinez. If you vape, do you need to stop prior to the surgery?
If you what? Sorry?
You vape?
Okay. Yes, it's important that we take care of this before surgery and after surgery as well. We have to stop. It's very important to help heal what we did of the procedure, and most important in a gastric bypass where we can see a high risk of margin ulcers. This is an ulcer that can form in the junction where we put together the pouch and the intestine. And this is a very associated complication with smoking or vaping and the ulcer. So it's very important that we stop smoking before surgery to improve our lungs and to improve the healing process, and after surgery to avoid complications secondary to these conditions.
Thank you. I have another question for you, Dr. Martinez. It says, after the surgery, do we get loose skin?
It always depends on how much weight we are losing, how much weight we had of excess. So the more weight that we lose, the more risk as we have of having loose skin. And the less weight that we lose, it's less probable. It's like when we have a pregnancy, we have a big belly, and then it comes back. There are people that go back practically to normal, and there are people that have a lot of loose skin. It depends as well on the elasticity of our skin and how much weight we lose.
Thank you, Dr. Martinez. I have a question for Mirza. Mirza, if I am paying cash, do I just set up an ACH?
Of course, yes, you can definitely do ACH transactions. The link we can send over, or you can also find it on our website. No additional fees are going to get charged when you pay with ACH or with Zelle.
Thank you, Mirza. Question for Dr. Martinez. This is a important question. It says, how many duodenal switch has Dr. Martinez performed?
Okay, so I have performed around 1,000. We perform around 300, 400 a year. And it can sound low numbers if we compare to gastric sleeve, gastric bypass, but let's remember that this is a very rare procedure that surgeons can perform. A lot of surgeons have performed one in their life, or they perform one in a year. And here we have a very, very high center of performing duodenal switch, and we perform 3 to 4, 5 a week. So it's a very, very high number. But compared to other bariatric surgeries, it can sound very low, right?
Thank you. Let's go with Paola. Do we account 2 weeks off of work, including the time leaving for Mexico, surgery days too?
No, you should add the 5 days for your trip to the 2 weeks post-surgery. Talking about that, we help with FMLA paperwork. The medical team can help with you for you with that. So if you need that for your work, to ask permission, PTO, insurance, disability insurance, we can help with that.
Thank you, Paola. Dr. Martinez, can you have high blood pressure if you want to do the surgery?
Yes, of course. And this is where we will have a great improvement in our levels of pressure. So it's just a matter of controlling it the most that we can before surgery to avoid complications, to avoid bleeding, to go into good conditions to surgery. This we will do with medication. And after surgery, because of the weight loss, we will see the improvement without medication.
Okay, another question. Once scheduled, can you change the type of procedure?
Yes, of course. And always, I like to talk to you before surgery. We talk before going to the OR. I tell you the benefits of the procedure that you are choosing, or the benefits of other procedures that I think that are better for you. And we can change this decision last moment if you want to, always for better.
Okay, thank you, Dr. Martinez. Is this person, sorry, I'm getting many questions. I ask patients because people are sending the same question again and again. I will get there. The next question is, when you can start exercising after cardio and lifting?
Okay, so from day one, you will be able to do normal activities like go to the bathroom, up and downstairs, all the normal movement that you have to do. You won't be in bed. And because of this, each day you can, from day one, you can start doing cardiovascular activity every day with a little effort extra. So you can start walking and then start adding a little effort, start jogging, running, any cardiovascular activity that you enjoy. It's important that we find something that we enjoy so we can stick to it long term. To be lifting weights more heavy, it's important to wait from 3 to 4 months until the inner part of our abdomen, the most strong part, is healed. And this takes 3 to 4 months. And this will be mainly to do big efforts with our abdomen, like an abdominal, doing squats with a lot of weight, doing big efforts. But to do cardiovascular activity, you can do whenever you feel ready, whenever you feel the energy to do it.
Thank you. Another question. I have GBS. Will that obstruct my recovery?
GBS. Let me see what this is.
While Dr. Martinez check that,
Yes.
let's have a question. We have a question for Paola. Can you come across border with birth certificate or passport?
So there is 2 ways. One with your passport, and then if you don't have a passport, you will need your birth certificate plus an state ID, and the names needs to match. If you married or divorced and for some reason you don't have the same name in one of the documents, you should add your marriage certificate or your divorce certificate, whatever is the case, but the names needs to match. So there is 2 options for that.
Thank you, Paola. Dr. Martinez, going back to you. I have GBS. Will that obstruct my recovery?
Yes, we have to see specifically in what conditions you are right now, what medications, in what stage you are, and depending on this, we can perform surgery or we have to wait.
Okay, thank you so much. Thank you so much, everyone, today for your amazing, great questions to our moderators. And thank you for being here. Please trust in us. If any questions, Mirza is gonna take care of you. She's staying with everybody that wanna stay after the webinar. Thank you, Paola, and thank you, Dr. Martinez.
Thank
Thank
you,
you, everyone.
everyone. Thank you for joining us. We have right now consultants waiting for you. If you have any more questions, here on the screen, you can see before and afters. We have very happy clients. So please don't hesitate to reach out. Our numbers are there. The health history is on the chat. So it takes 3 minutes. Fill out the form and we will reach back to you.
Thank you everyone for joining, and don't forget to follow us on Instagram, Facebook, TikTok. Our phones are open to you. So we are waiting for you. If you're ready to make this change and start this journey, our client consultants are going to be there for you, along as with our doctor, and also Paola's team is ready to go ahead and help you out with everything that you might need. Okay, so we're gonna be in a little bit, we're gonna just hang out here a little bit in case you have anything else you want to comment on us. You already know our webpage and all of our social media. We're gonna be happy to assist you.
Thank you, guys. Have a good weekend.
Bye.
Thank you, doctor.